I'm Dr. Sangeetha Sajesh. I'm working as consultant nephrologist at Anandabari Hospital, Trivandrum. I've been working since 2018, and today the topic is chronic kidney disease and peripheral edema. So before we go to the peripheral edema portion, so let's see what is chronic kidney disease. So chronic kidney disease, as the name mentions, that is chronic. So what is chronic? That is the persistence of kidney dysfunction or renal dysfunction lasting more than 3 months is called chronic. So if the kidney dysfunction, how do we classify? How do we classify or how do we stage the chronic kidney disease? So depending on this type of kidney dysfunction or depending on the kidney function, we have been classifying chronic kidney disease into 5 different stages. So stage 1, 2, 3, 4, and 5. So before going to the stages, so what are the major causes of chronic kidney disease? So India being the diabetes capital of the world, the majority of patients with chronic kidney disease could be due to diabetic nephropathy, or diabetic kidney disease is the major reason of chronic kidney disease in our country. And there are other factors like hypertension or high BP, then obstruction like prostatomegaly or stones, then other glomerular disorders. So there are various reasons why patients can have kidney dysfunction. So when we consider chronic kidney disease, there should be another entity called acute kidney injury. That is the kidney dysfunctions which occur as a result of infections like fever, like dengue fever, leptospirosis, sepsis, etc. So the importance of such acute kidney injury is that it is usually recovery. The recovery may be complete, and it's not persisting for it's not persisting. So that is why we classify this into acute kidney injury and chronic kidney disease. But in chronic kidney disease, if the kidney dysfunction is continuously persisting for more than 3 months, and if the GFR or the glomerular filtration rate, if it is less than 60 ml per minute, we classify it as chronic kidney disease. And as I already mentioned, the majority is due to diabetic kidney disease. So when we classify into different stages, the stage 1 is chronic kidney disease is GFR or glomerular filtration rate more than 90 ml per minute. But patient could have other urinary abnormalities like protein leak in urine or blood in urine, or there could be ultrasound abnormalities. There could be other tubular abnormalities. So that is called stage 1. And stage 2 is GFR between 60 to 89 and ml per minute. So there is mild derangement in the kidney function. And stage 3 is moderate, that is between 30 to 59. And then stage 4 is between 15 to 29 ml per minute. And stage 5 or advanced renal failure or end-stage renal disease is GFR or glomerular filtration rate less than 15 ml per minute. So that is the classification. That's how we classify chronic kidney disease. So the patients whom we take for dialysis in chronic kidney disease belong to the stage 5 CKD, that is end-stage renal disease. So why is chronic kidney disease and what are the implications of a kidney disease in our body? For that, we have to know what are the functions of the kidney. So we all know that the kidneys deal with the excretion of waste products from our body. But what we have to understand is that it's not the only function or that kidney does in our body. So there are many other major functions that kidney has to perform, that kidney performs in our body. So one important function is the acid-base balance. That is, our blood's acid-base balance is maintained by the major function is by the kidney. And then another one important aspect is the bone and mineral metabolism, like calcium, phosphorus, parathermone, etc. And then production of hemoglobin. That is also one important aspect the kidney has to take care of. And then control of blood pressure is also very important. So these are all very important aspects of the that the kidney does, apart from the excretion of the waste products. So whenever the kidney function deteriorates, all these can get impaired. That means the patients can develop symptoms because of all these problems, like patient can develop no hemoglobin because since it is damaged, and then patients can develop hypertension or high BP, and then there could be, because of the impaired excretion of waste products, there could be accumulation of these and cause various other symptoms. And then control of, as I've told, acid-base balance. So acid-base imbalances can occur, leading to metabolic acidosis. Then because of the bone and mineral metabolism derangements, patients can develop calcium, phosphorus, parathermol, all these axes will get impaired. So all these are various aspects of the kidney functions apart from the excretion of the waste products. So the one important aspect that we have to think about when we consider kidney diseases is in the initial stages, majority of kidney diseases in the initial stages may be asymptomatic. What asymptomatic means? Without any symptoms. So patients may not detect, patient may not identify these problems unless they do a routine blood test or urine test or a BP checkup, or for some other reason, if they do an incident, or it could be an incidental finding, like doing an ultrasound or doing some other, while doing some other procedure as a checkup. When they do, they may identify that they have some kidney problem. So in the initial phases, in the stage 1 or 2, they may not identify that they have some issues. Or as the stage advances, each and every symptoms may start appear. So let's see what are the symptoms or what are the ways in which patients can present when they have kidney problems. So depending on the kidney functions, like the way in which patients can present will also vary. So it means all patients with the kidney disease patients, depending on the GFR, they cannot, or depending on their glomerular filtration rate, the way they present with symptoms may also vary. So the patient with in a stage 4 or stage 5 CKD presentation to hospital may be entirely different compared when you compare with a stage 1 or 2 or 3 patient. So their advice or the treatment modalities all may also vary. So let's see what are the common symptoms of chronic kidney disease. So it could be from the whatever functions that we have told about kidney, that already the hemoglobin, BP. So all these problems can occur in a patient with chronic kidney disease. So patient can have high blood pressure. Then high blood pressure is one important major symptom of chronic kidney disease. And then patient can have urinary abnormalities in urine, like there could be frothing of urine or blood in urine, or there could be increase or decrease in the urine output, or there could be increased frequency of micturition, or there could be other problems like difficulty to hold urine or incontinence of urine. So all this, there could be a wide variety of urinary abnormalities which can occur in chronic kidney disease. Then patient can develop anemia. What anemia is? Decrease in the hemoglobin level in the body. So anemia is a very important symptom of chronic kidney disease because many times there are situations where patients undergo repeated blood transfusions without knowing that the cause of anemia is chronic kidney disease. Thus, the patients can present with severe anemia with chronic kidney disease. Then other factors like other problems like swelling of the body, that is that fluid retention and swelling of the body is a major symptom of chronic kidney disease. It could be initially it could be early morning puffiness of face, that is puffiness of the upper eyelids, which could be there in the early morning, and as the fluid retention increases, there could be swelling of the feet and ankle, and then there could be swelling of the entire body called anasarca as the situation worsens. So swelling of the body and fluid retention is an important symptom of the chronic kidney disease patients. Then there are other symptoms like as the kidney function deteriorates. We have already told kidney has one of the major function of the kidney is to excrete the waste products from our body, the nitrogenous waste products from our body. So whenever the kidney function is impaired, these will get accumulated inside our body. So what will happen is the patient can develop nausea, vomiting, then anorexia or decreased food intake. Patient can have loss of appetite, and then pruritus because of these products. They can have pruritus or itching of all over the body. So all these can occur. And once the stage advances, patient can develop breathlessness and exertional dyspnea, exertional breathlessness. Patient will have difficulty to perform even mild exertion that can occur, and they can develop other severe issues like say acute pulmonary edema, hypertensive emergency. Acute pulmonary edema is the fluid retention which can occur in the lung, and patient can also develop other complications like altered sensorium. So all these are different ways in which patients can present in chronic kidney disease. We have talked about what are the ways in which chronic kidney disease can present. And now we are going to what are the symptoms also we have discussed. And we have mentioned already that one of the major symptoms of chronic kidney disease is edema, that is accumulation of fluid in the body. So it could be from the early morning puffiness of face, puffiness of eyelids, which can gradually disappear as the day advances, or it could be swelling of the feet and ankles, which could be there for a earlier, it could be there by, it could disappear by afternoon, and then as the fluid retention increases or worsens, patient can have increased breathlessness and swelling of all over the body. So today we'll be discussing more in detail about edema. So what is edema? Edema is the accumulation of fluid in the body. So this fluid retention is called edema. So fluid retention is mainly in the loose tissues. That is the area where it initially happens, like peripheral edema, or it could be pedal edema, that is swelling of the body, swelling of the legs, ankle, or feet. That is called pedal edema. Or it could be pulmonary edema. Pulmonary edema is the situation in which lungs get fluid gets accumulated inside the lung and patient present with severe breathlessness. That is pulmonary edema. Or there could be cerebral edema. So there are various ways in which edema can present in a chronic kidney disease patients. In a chronic kidney disease patient, all the time this edema may not be due to it may have other factors as well, other reasons as well. So other reasons for edema could be due to cardiac cause, like a patient with cardiac failure, he can present with edema, or swelling of the body, or especially swelling of the feet. And then cirrhosis or liver disease. Liver disease can present with swelling of the body or edema. And then severe anemia is another reason for causing edema. And then patients with on some medications like calcium channel blockers, they can present with edema. Then malnutrition leading to hypoalbuminemia is one major reason for causing edema. So these are the different reasons why, and in pregnancy and other hormonal imbalances, hypothyroidism. So there are various reasons why patients can develop edema. So the importance of understanding the etiology or the reason why a patient develops edema is very important in treatment. So otherwise patients may not get a full benefit of the treatment. So we have to identify the reason why a person develops edema before addressing the treatment, before thinking about the treatment. So when we consider edema in a chronic kidney disease patient, as of our topic today, let's see what is the reason for edema. So edema in a chronic kidney disease patient can occur due to two reasons. One is the loss of protein in via the loss of large volume protein via urine. That is one major mechanism by which patient can develop edema. So another thing is, another reason is the impaired kidney function itself, because kidney is not able to do its function properly so as to remove the excess waste materials by urine, via urine. So the impaired kidney function is one reason. And the another reason is the loss of protein, that is especially albumin via urine. So one major syndrome, that is nephrotic syndrome, is one major entity which here where the patients present with generalized swelling of the body with massive proteinuria, that's large volume protein loss via urine, and patients will present with anasarca. Anasarca is generalized swelling of the entire body. So here when the major protein that is lost via urine is albumin. So what is why is albumin important? Albumin is important to maintain the oncotic pressure in our body. So whenever there is a loss of albumin via urine, the serum albumin level or the blood level of serum albumin will be low, and there will be so the blood vessels won't be able to hold on this fluid, and there will be leakage of fluid from the blood vessels. And when there is loss of blood volume, when there is leakage, the kidney senses that there is a less loss in blood volume, and it will try to retain the salt and along with that fluid also. So this will cause fluid retention in our body. And then the major symptom is edema. So I've already told you the reasons of, there could be other reasons. So whenever we try to treat, whenever we are aiming to treat chronic kidney disease edema, we have to identify and correct other factors as well. So today, let's see what are the treatment options. So how do we treat edema? So when we consider the treatment options for edema, first and foremost is the reduction of the salt intake and reduction of the water intake. So whether it is cardiac or renal issue, or whether it is hepatic or whatever, whether it is due to anemia, after correcting all these factors, then still we have to tell the patient to reduce the salt intake. That is of very much important, because for the action of the other medicines that we give also, reduction of salt intake is very much important. So excess salt in the form of processed food or canned fish or meat, all these should be avoided, and the reduction of salt intake is very important. And in cardiac and renal dysfunction with edema in a fluid overloaded patient, we always ask them to restrict the water intake as well. So once the patient has excess fluid in the body, we ask them to restrict the water intake. And then there are medications by which we can help to excrete the excess water in the body. So the major group of drugs which help to reduce water intake, to help increase water excretion from the body is diuretics. So these diuretics are a class of drugs which help to excrete the excess water from the body and helps the patient to relieve the edema. So majority of the patient who comes to hospital would have noticed edema by themselves, and they come to OP with the complaint that they have noticed swelling of the feet when they get up in the morning. So this edema, the importance or the characteristic feature of the edema due to chronic kidney disease is usually it will be noticed in the early morning, and as the day advances, it gets disappeared. But as the situation worsens or as the kidney function deteriorates, this edema may persist for a longer time, or it may be there for the entire day and night. And as it advances, patient will develop other problems like breathing difficulty and other issues could be there, and generalized swelling of the body can occur. So when we check the patient for edema, when we palpate, or when we see the patient on physical examination, we can see the skin is stretched and shiny. And when we palpate, when we press the patient, when we give a pressure on the ankle, if we are leaving a pressure for more than 30 seconds, we can see that there are dips in there are depressions, or called pitting pedal edema. So that is one characteristic feature of chronic kidney disease. So whenever patient has a pitting pedal edema, that means patient has significant amount of fluid retained inside the body. So in such cases, what we have to give is diuretics. After giving this reduction of salt and water intake, and for the excretion of excess water in the body, we ask them to we prescribe them diuretics. So diuretics will help to excrete the excess water from the body. So whenever we give diuretics, the patient will have this increased frequency of urination, and they will have increased, the excess water will be excreted from the body as urine. So one important factor that we have to remember is whenever we give the diuretics, there will be increased, there could be patient can develop hypotension or lowering of BP, or there could be fluctuations in BP. And it's not only water, they also excrete some salt and other minerals too. So patients require a monitoring and like sodium, potassium, etc., and also BP and daily weight. Then so after giving, so we have given a reduction of salt and water intake, and then diuretics, and then there are some other modalities by which we can also help in a patient with pedal edema. That one is compression stockings. Compression stockings are also important because it can help to relieve edema in the initial stages, and also it may help patients to relieve edema. But one important thing that we have to remember is if in some patients it can cause irritation of the skin and cause minor abrasions, so that we have to be cautious about it. Then another this leg elevation. So limb elevation is also important. So whenever a patient with pedal edema comes, we have to advise the patients to keep their limb elevated, so that there will be reduction in the fluid accumulation in the legs. So we ask the patients to elevate the limb around about 30 degrees above the heart level. So that's what, especially on lying down at night, especially we ask them to keep the leg side elevated, so that patients will have a better reduction in the fluid accumulation. So this pedal edema is one of the major symptoms of the chronic kidney disease. It could be an initial symptom, which is most often seen by noticed by the patient itself or by another family member. So the importance of chronic kidney disease is mainly in identifying it at the right time, so that we can delay the progression of chronic kidney disease. That is very important in the prevention aspect, because especially in patients that I've already told you, it's majority of patients with chronic kidney disease is mainly due to diabetes and hypertension. In such patients, the other family members, if they have a positive family history of diabetes or hypertension, we can ask the patients' other family members to check for periodic checkup, so that they can identify the emergence of such diseases at a much earlier time, so that we can help them to identify the abnormalities in urine, blood, or BP at an earlier point of time itself, and then we will be able to delay the progression or slow the progression of the chronic kidney disease. So today we have discussed about the edema and its major causes, then how the symptoms and signs of chronic kidney disease, and then how this edema could be tackled, and how the diuretics become a major cornerstone of therapy in treatment of edema. So there it ends. Thank you.